everyone, this is Suprava. Welcome back to another session with me. In today's session, we will be discussing about coma in children. So, coma is a life-threatening condition, and it can be caused, due to several conditions where, it affects the central nervous system, whether directly or might be indirectly. So, let us move on to the meaning of coma. So, coma is a state of profound unconsciousness from which the patient cannot be aroused even by powerful stimuli. So, coma is basically a state of unconsciousness. That means the person will be unconscious, and even if you apply a powerful stimuli, you cannot arouse the patient. So this term coma refers to deep sleep which indicates a prolonged state of unarousable. So basically what we understood is that coma is a state where the person would be unresponsive, right? The person is unconscious, and even if you apply a powerful stimuli, for example, if you give visual stimuli or auditory or tactile stimuli, in that case also there won't be any spontaneous movement. So here basically the person would be won't be responsive, the person would be unconscious, and there can be several stages of altered consciousness. So next let us learn what are the stages of altered consciousness. So the first stage of altered consciousness can be drowsiness. Now here the person would have reduced awareness or wakefulness, and also it would be alternated with drowsiness or clouding. And then there is confusion. So in confusion, what happens? The person would be unable to, think clearly, and also there would be disorientation. So the person would be oriented with the time, place, and person. Next is delirium. Now in delirium, what happens? The person would be, disoriented definitely. There would be hyperactivity, irritability, and also hallucinations and talkativeness. Next, there is obtundation. So in this, what happens? There would be reduced alertness. And the next one is stupor. So stupor is something which we also call it as semi-coma. So that means the person is not completely comatose. So what happens here? The person would be unresponsive but arousable. Now how you can arouse the patient? So here you can apply vigorous stimuli. So and the stimuli should be repeated. So when you are providing vigorous repeated stimulation, the person can be arousable. But once you withdraw the stimuli, again the person will go back to unresponsiveness. And then there is coma. So here the child will be completely unresponsive and also unarousable by any stimulus. So I think you can understand the difference between stupor and coma, right? So in stupor, what happens? The child will be unresponsive, but if you provide vigorous stimulation, repeated stimulation, then you can arouse the child, right? But here in coma, what happens? The child will be unresponsive and unarousable, and even if you provide any sort of stimulation, you cannot arouse the patient. Next, there are grades of coma. So the first one is stage 1 or stupor. Now here the patient can be aroused for very short duration, and the patient will show verbal and motor response to the stimuli. So if you provide any vigorous stimulation, and if you are providing the stimulation repeatedly, in that case you can arouse the patient for a very short duration, and also the patient will show verbal and motor response to the stimuli. And the next stage is stage 2 or light coma. So here the patient cannot be aroused easily except with a painful stimuli. So if you provide any painful stimuli, the patient might be aroused. And the third stage is called as deep coma. So here there won't be any response to painful stimulation also, and the patient will have loss of cortical control over the motor functions. And then there is stage 4, which is called as brain death. So here all the cerebral functions would be lost, and also the pupillary reflexes would be absent in this stage. Next, moving on to the causes of coma. So here the first thing is infection. Now if there is any sort of infection, for example if there is meningitis or encephalitis or brain abscess, or if there is septicemia, so all these things might cause coma in a child. And then if there is metabolic disorders, so if there is hypoglycemia or hyperglycemia or diabetic ketoacidosis and acid-base imbalance, so in all these cases also there is a chance that it might cause coma. And then there is drugs and poison. So there are certain drugs, if those are if there is overdosage of these drugs, then it might cause coma. So also if it is inappropriately administered, or if there is an idiopathic reaction, or if there is any adverse reaction, then again drugs also might cause coma. Well, these were some of the causes of coma. Now next, moving on to the diagnosis. So here in diagnosis, the first thing that we will do is history collection. So in history collection, if there is head trauma, or if there is ingestion of drugs or toxins, and if there is fever, so that would tell us if there is signs of infection or any viral illness is there. And then also if the child is having headache, so along with headache, there is also if the child has nausea, vomiting, or any other signs of increased intracranial pressure, or might be meningitis. So all these things you have to collect. And then if there is seizures or diabetes, or even if there is any pre-existing neurological disease, or if there is previous episodes of coma, so all these history you should collect. And along with that, we would also do the neurological examination. So for that, we have to check the GCS score. Now that would tell us what is the level of consciousness in the child. So while doing, for the Glasgow Coma Scale score, for that we have to, check the eye opening response of the child. We will also check the verbal response and motor response of the child. And along with all these things, we would also check what is the, how is the reflexes. And then there are certain lab investigations which we can do to rule out the underlying causes. So we can do glucose, electrolytes in blood, urea, nitrogen, or creatinine. And also we can check the calcium level, and along with that the complete blood count and ABG analysis. And then we can also do certain imaging studies, right? So for imaging studies, what we can do, we can perform, CT scan. So that would tell us if there is any hemorrhage present inside the brain, and if that is causing the coma in the child, right? So the underlying cause can be ruled out. And then we can also perform lumbar puncture. So that would tell us if there is any infection or, bleeding, or if there is increased intracranial pressure. And then we can also perform EEG. So that would, help us to rule out the brain activities. Now next, moving on to the management. So the first, initial stabilization would be, we would focus on the respiratory and hemodynamic status, right? So for that, we have to manage the airway, breathing, and circulation. So firstly, we have to make sure that the airway is patent and it is clear, it is not obstructed. And then we have to establish the breathing. So if there is need of endotracheal intubation, then we have to do endotracheal intubation for the child. And we have to place large bore IV lines, and we have to make sure that we provide isotonic fluids. So here we have to make sure that we are able to maintain the adequate blood pressure. Also, we have to hyperventilate the child to decrease the blood carbon dioxide, and we have to maintain adequate perfusion. And to maximize the cerebral venous drainage, what we can do is we can elevate the head of the bed to 30 degree. Next, moving on to the nursing interventions. So in nursing interventions, the first thing that we can do as a nurse would be maintaining an effective airway. So how you can maintain an effective airway? So definitely the first thing that we would do by positioning, right? So we have to provide a proper position to the child. So for that, we can elevate the head of the bed, or also we can turn the head to one side. So that would help in draining the respiratory secretions, and that would also prevent the tongue to fall back. So basically this would prevent from obstructing the airway, and this is the way we can keep the airway clean and clear. Also, if there is any secretions which is blocking the airway, then you can do frequent suctioning, and you have to make sure that you provide adequate oxygen to the child. And the next thing would be minimizing secondary brain injury. So how you can do that? We have to continuously monitor the respiratory pattern, the vital signs, and the neurological status of the child, and also the level of consciousness. So if any deviation in all these things, that would tell us if there is a risk for secondary brain injury. And next, you have to maintain the fluid and electrolyte balance. So that we can do by administering fluid therapy and also monitoring the hydration and the electrolyte status of the child. And then you have to provide eye care also. So here definitely the child is not conscious, here the child is not responsive, so and you cannot arouse the patient also, right? So here you have to make sure that you provide eye care with proper aseptic precautions and medications. And also you have to provide oral care. So here you have to make sure that you maintain the healthy oral mucosa. Next, you have to maintain skin integrity. So here, as the patient is not responsive and the patient is not arousable, and the patient would be there on the bed for a prolonged time, right? So with this prolonged immobility, there are a lot of risks which are associated, right? So the patient might get bed sore. So for that, you have to maintain the skin integrity. You have to continuously change their position. You also have to provide back care, and you have to make sure that the bed is tidy and clean, and you provide range of motion exercises, and you monitor the skin conditions of the child. Next, you have to make sure that you provide adequate nutrition to the child, and also you have to promote urinary elimination. So again, the child is having prolonged immobility. So in that case, again, there is there would be risk of urine incontinence. So for that, you have to promote urinary elimination. So these were some of the nursing interventions that you can consider when you are taking care of a child with coma. So these were some of the nursing interventions that you can consider while taking care of a child with coma. Next, moving on to the complications. So here in complications, there might be respiratory failure, or there might be deep venous thrombosis. Again, the child is there on the bed for a prolonged time. There is prolonged immobility. So that is why these risks are involved, and there might be pneumonia as complication. Well, so that was all about today's session. I hope you have got a better insight about the topic. Thank you.